I woke up, my left arm was hurting, and it was just real sore and stiff, like I had slept on that same side all night long. And this lasted for 3 or 4 days. So I had a good friend of mine that actually had a motorcycle injury, and I'd heard of Dr. Burg through him. So I went ahead and got the MRI and came back, and he said, well, you've got a herniated disc in your neck that's pushing up against your spinal cord and it's sending nerve signal down. And he said the main issue is that you've lost almost all of your muscle strength in that arm.
Usually when patients come in with problems in the neck, they have neck pain, they have problems moving their neck in certain directions, they have weakness in the arms, sometimes in the legs. Occasionally they have bowel and bladder dysfunction. But usually their problems are just in the arms. They have numbness and tingling into their fingers, some weakness in their hands. Oftentimes they realize they can't open up a jar of peanut butter or something simple like that because their hand feels weak. We talked about his options. As far as recovery goes, we talked about the downsides potentially of having a fusion operation in your neck, especially at a young age, and he opted for the disc replacement.
I'm the type of patient that avoids going to the doctor. I don't like going to get checkups because I don't like getting poked and prodded and all that experience. And so had he not been very assertive, I probably would have just tried to fight through the pain as long as possible. We went ahead and did it, and the results were fantastic. The recovery was extremely easy. I had gone on the internet and done all the research on my own and read all the horror stories and whatnot about just, surgery in general, and so I was very nervous going into it.
This type of surgery in the neck has been done for years, and it's truly minimally invasive surgery. You're not splitting muscles, you're not cutting anything. Patients recover fairly quickly. That's one of the reasons to choose that over a fusion operation. With the fusion, you're waiting several months before you're back to your normal activities, but often with the disc replacement, you're back to doing whatever you want to within 6 weeks. Some people with more strenuous exercise or rigorous activities, we like to wait a little bit longer, even up to about 3 months.
Looking back now, it was one of the best decisions I've ever made, and it was just a great overall experience.